Welcome to Crystal Medical Life. Today we are going to discuss about the most important 40 or top 40 stain performed in medical laboratories. So we will start with first stain, which is a gram stain. It differentiates bacteria by cell wall structure, which is a peptidoglycan. Increased amount of peptidoglycan seen in the gram positive bacteria, and they retain the crystal violet iodine complex, and gram negative bacteria, they have very thin peptidoglycan layers, and they decolorized and counterstained with red dye. So here the key reagent are the crystal violet, gram iodine, alcohol acetone for decolorizer, and safranin or carbol fusion, which is a counterstain. And this is used in routine microbiology for bacterial classification. So these are the gram positive bacteria, and these are the gram negative and gram positive. So these red colors are the gram negative, and this one is the gram positive. Next stain is Ziehl Neelsen stain, which is also called as a Zeren stain or acid fast bacilli stain, and it is used to detect acid fast bacilli. Here, the carbol fuchsin, which is a basic fuchsin plus phenol, is applied on the Mycobacterium cell wall, which is made up of the mycolic acid, and with the help of heat. After that, we will apply the acid alcohol decolorizer. If the cell wall resists decolorization, then it will be acid fast bacilli, and the one who do not resist decolorization become the non-acid fast bacilli. One who resists become red because of the carbon pushing, and one who cannot resist become the blue by the methylene blue counter stain for the Mycobacterium species, and these are the Mycobacterium tuberculosis. Next stain is the Kinyoun stain, which is the same as Zn stain minus heat. So here we use the higher concentration of the carbol fuchsin and the phenol, allowing staining without heat. Component are same as Zn stain, but this is used in the stool cyst of the coccidian parasites like Cryptosporidium and Cyclospora. You can see here. Next one is the Auramine Rhodamine fluorescent stain. So it is same as Zn stain, but you need IF microscope for visualization of this dye. So we use Auramine O and Rhodamine B, and mechanism is same as the Zn stain. Next is the Fite Faraco stain, which is also used for Mycobacterium, but Mycobacterium lepra and nocardia. In this organism, there are very less amount of mycolic acid. So you cannot use a strong amount of acid alcohol. So you will use a peanut oil or xylene to preserve cell wall lipid, and very less concentration of the sulfuric acid, which is 1%. So you can see the skin biopsy with the lobules of lepra bacilli. Next stain is Warthin Starry stain. So this is agyrophilic silver impregnation method used for the detection of the spirochetes. Here you impregnated tissue with the silver nitrate solution, and here this silver solution will reduce to the black metallic silver deposit. And here we do not use the counter stain. So it is used for the Helicobacter pylori, Treponema pallidum, insipidus, and Leptospira. So you can see the image. Next stain is the Steiner and Dietral silver stain, same as Warthin stain. You have to do reduction process by the hydroquinone in the Steiner or formalin. If you are using the formalin, then it is a Dietral modification. This method intensify the staining and reduce background. So same as Helicobacter pylori or Legionella silver stain. Next stain is the Giemsa stain, which is a Romanowsky type stain, and this is the metachromatic stain combining the methylene blue and eosin. So these are the opposite dye. So acidic structure, which are the DNA, RNA, ribosome, they take up the thiazine dye and appear blue in color. And basic component like hemoglobin, eosinophilic granules, they will take up the eosin and appear as a pink. So here key component are the azure B, methylene blue, eosin Y, and they are used for the blood smear and bone marrow aspirate. So this is the image of the Giemsa stain. Next stain is the Alcian yellow toluidine blue Leon Gibbon stain. So do not worry about this. This toluidine blue will stain H. pylori blue color, and this Alcian colors mucin as yellow. So Helicobacter pylori and periodic acid oxidation in Alcian yellow target gastric mucin stain them yellow, and toluidine blue stain H. pylori. So high contrast image of the blue bacteria on yellow mucin background you will see, and this is used for the H. pylori. This is Alcian yellow stain background, which is yellow background, and here you can see the H. pylori organism. Next stain is the periodic acid skips stain, which is also called as PAS stain. So this is histochemical reaction demonstrate the polysaccharide. So in polysaccharide there are the glycol groups, and these glycol groups will be oxidized to aldehydes, and this aldehyde then react with the Skips reagent to form the bright magenta end product. So it will appear as magenta color. So what it will stain? Glycogen, neutral mucin, fungal cell wall, and used in the fungal infection identification, liver biopsy, then basement membrane in kidney biopsy, and you have to find out the mucin in the adenocarcinoma. You can use the periodic acid skip stain, which is PAS stain, and you can see here kidney biopsy, and you are seeing the basement membrane highlighted by the PAS stain. Next is Grocott methamine silver stain. So tissue is first oxidized with the chromic acid, and it creates the aldehyde groups on the fungal cell wall polysaccharide. Then you have to apply the methanamine silver solution, and this pre-aldehyde now reduce the silver ion in this silver solution to visible black metallic silver in situ. And you can use the background color as a light green counter stain, which is light green SF. So it is used in the fungal infection detection. So you can see the fungi in the GMS stain. Next stain is the Gridley fungal stain. So you should know that there is a fungal stain called the Gridley. And you can see here, this is mycetoma. And this image is from the CDC. This is a Gridley fungal stain. Next is the Calcofluor white stain. This is fluorescent stain, and it binds to beta-linked polysaccharide such as cellulose and chitin in the fungal cell wall, and they emit a bright apple green or blue-white fluorescence. So you have to detect it under the fluorescent microscopy. And this is for the rapid screening of the fungi. So you can see how Calcofluor white stain look like. Next stain is the Mucicarmine, also called Mayer's Mucicarmine stain. So it is a specific for the acid polysaccharide, which is seen in the mucin of the epithelial origin. So here the aluminum mordant is used and carmine dye is used. So this complex will bind to the acid mucin and give some bright rose red color. And it is used to identify adenocarcinoma, which is mucin producing, and you can distinguish it from the squamous cell carcinoma, which will not produce mucin. And you can highlight goblet cells in the GI tract and also the Cryptococcus neoformans. So this is the Mucicarmine stain look like. Next stain is the Alcian blue at the pH 2.5. Copper thiocyanine dye that bind to acid mucopolysaccharides, which is also called the acid mucin. At 2.5 pH, Alcian blue carries a positive charge, and it will attach to the polyanionic compounds like sulfated glycosamine glycan and carboxylated sialomucin, staining them turquoise blue color. So you can see here turquoise blue color. So you have to distinguish acidic mucin in tissue. So goblet cells, bronchial mucin, and cartilage matrix. Next is combined PAS and Alcian blue stain. You know about the PAS stain. You know about the Alcian blue just now. Now we have to do combination stain to differentiate various type of mucin. So AB pass is for the types of mucin: acidic mucin, basic mucin, neutral mucin. So you will use sequential stain. First you will do the Alcian blue stain and followed by the pass. Acid mucin will appear as blue color. Neutral mucin come as magenta color and mixed mucin come as purple from overlap. So you can see the various type of mucin. Here color is different, here the color is different. So next one is the colloidal ion Muller-Maury stain. Again, this is for the acid mucin. We use colloidal ferric hydroxide solution that bind to anionic mucin. The loosely bound ion is then visualized by the Prussian blue reaction. You should know that Muller-Maury stain is used for acid mucin and colloidal ion stain is used for same acid mucin. So do not make mistake. This is how it look like. Next one is the Whitley's trichome. You should focus on the few things about it. It is used to detect fecal parasites like Entamoeba histolytica, Giardia lambia cyst, Blastocystis, Cryptosporidium. And here we use the Whitley's trichome stain, acid alcohol for differentiation. Next one is the Mason trichome stain. This is very important stain. And here we use the 3-color staining protocol to distinguish collagen from the muscle. First, you have to do the nuclear staining, which is done by the Vigar's Hematoxylin. After that, you have to apply acid fuchsin, which is acidic dye, which penetrate into the muscle and make it red. Or also, it will penetrate into the collagen. But when you apply the second dye, which is the aniline blue, it will penetrate into the collagen because collagen has more porosity and it will make collagen blue or green and muscle will appear as red. So finally, you can distinguish fibrosis from the muscle. So this is how Mason trichome look like. Next is the reticulin stain, also called Gordon and Sweet silver stain. So this is also a silver impregnation method and it highlights the type 3 collagen. First, the tissue is first oxidized by the potassium permanganate to enhance the fiber visibility, then sensitized with the iron salt, which deposit on reticulin fiber, and subsequent treatment with the silver nitrate. And we will apply the formalin, and it will reduce the silver and it make the black color fibers. So it is used in the liver, bone marrow, and lymph node biopsy to see the reticulin mass work. So this is how the reticulin stain look like. Next stain is Verhoef von Giesen stain. It is used for the elastic fiber and this is a regressive stain. So first your iron hematoxylin solution will overstain entire tissue. Then so you have to remove this excess dye with the help of ferric chloride. But here the structure with the strong affinity will not leave this dye, and that strong affinity structures are the elastic fibers, and it will emerge as the black blue color. This is black blue fibers are the elastic fibers in a artery, and it is used in the arthritis, emphysema, vascular Ehlers-Danlos, or pseudoxanthoma specimens. Next is the Auramine and resorcine fusion stain, and here this is Auramine is a natural dye from the lichens, and resorcine fusion, a variant by Hart and Wigert, specifically bind elastic fiber due to their affinity for the elastin chemical groups, and it will give deep purple coloration. Elastic fiber also demonstrate hepatitis B surface antigen in hepatocyte and intracellular copper. Next stain is the Mowart's pentachrome. It is a 5-color staining method and subsequently applied. So here you will see the mucin as blue, elastic fibers as black, muscle as red, collagen as yellow, and nuclei as black color. So what are the key reagent? Alcian blue, Verhoef hematoxylin, Crossan scarlet or acid fuchsin, 5% phosphotungstic acid, alcoholic saffron, and we are using it in cardiovascular pathology. So this is beautiful stain in histopathology. Next one is the phosphotungstic acid hematoxylin. you should know about only one thing. It is used for the muscle striation and fibrae. Next one is the Congo red stain, and here this is most important stain. Congo red is a azobenzidine dye that aligns along beta-plated sheet structure of the amyloid protein and make the non-covalent bonds, and this will produce salmon pink color. And when you use a polarized light, reflect the it will reflect apple green birefringence. This is how salmon pink color is look like, and this is how apple green birefringence seen in the polarized microscopy. Next one is the theoflavin T. This is also a amyloid stain, same mechanism, but this is a fluorescent dye. So you have to use immunofluorescent microscopy. Key reagent are the theoflavin T, potassium permanganate, and counter stain Ivan blue. So it is look like this. Next is pulse Persian blue stain. So it demonstrates the ferric ion Fe3 plus, and we are using acidified potassium ferrocyanide via the SCl. So if there is any ferric ion in the tissue, it will bind to this potassium ferrocyanide and make the insoluble ferric ferrocyanide, which is a Persian blue pigment, and use to detect the ion storage in the tissue. So we use in the bone marrow biopsies. So you can see the how it look like. Next is Turnbull's blue stain. It detects ferrous ion. So it is a research stain. Next one is a Rhodamine stain. So not Rhodamine. Mine is used in tuberculosis and 9 is used in the copper. So copper's ability to form a colored complex with the rhodamine. This is the simple principle, and it will produce the red orange to brick red color. And you can use the hematoxylin for light blue color background. And you can diagnose the Wilson disease from the rhodamine stain. And it is a look like this. So now for calcium, we have two stain. First one is the indirect stain, which is a one fossa stain. And here we treat tissue with the silver nitrate, and here the silver ion replaces the calcium. And when you expose it to the strong light, the silver reduces to the metallic silver, turning the deposit black. So earlier there was calcium, but now there is silver. So you have to interpret that these silver areas are earlier as a calcified areas. So you will see like this. So next stain is the alizarin red S, which is a direct stain. So it will bind to the calcium complex because this is the anthraquinone dye, and it produces the orange red to red color at the pH 4.2. So you can see here the calcium deposit turn out as red in the alizarin red S stain. Next one is the Fauchet stain, and it is used for the bile pigment demonstration. And the principle is that it oxidizes, this reagent oxidizes bilirubin into the biliverdin, which is green in color. What is the use? Detection of the cholestasis or bile thrombi in liver biopsy. So you can see here, Fauchet stain is marking the bile pigments in the liver biopsy. Next stain is the Fontana-Mason stain. So melanin and argentafin granules can reduce the anonical silver to visible metallic silvers without an external reducer. So you just have to put silver without any external reducer, and if it will reduce, then it is because of the melanin or argentafin granules from the neuroendocrine tumor. Used for melanin pigment detection in skin biopsy. You can see here the black color due to the Fontana-Mason stain. Next one is the Papinicula stain, also called as the PEP stain. This is a multichromatic cytologic stain, and here we use three type of stain in one stain. So first one is the hematoxylin for nuclei, then orange for keratinized cytoplasm, and third one is, and most important component, which is the eosin azure polychrome. It contains eosin Y, then green SF, and Bismarck brown. So as a result, there are so many colors in the PEP stain, and it is very useful in the cervical cytology and cytopathology. Next one is the toluidine blue. So this is metachromatic basic dye that stain acidic tissue component. Simple principle, it will cause the metachromasia, and we used in the frozen section and also to detect the mast cell in the tissue. So you can see. Next one is the myeloperoxidase stain. So myeloid is named from the myeloperoxidase. So they having the myeloperoxidase in there, and this myeloperoxidase oxidize the chromogenic substrate like the benzidine or DAB in the presence of the hydrogen peroxide. So resulting in insoluble colored precipitate at the site of enzyme activity. So it will come as a brown color pigment if it is a MPO positive. So myeloid have MPO activity and lymphoblasts are MPO negative. So you can see these are the myeloblast. So next stain is the Sudan black B stain, which is also used to differentiate the myeloblast from the lymphoblast. But here it is a not enzymatic process. But here they stain the granulocytic lineage lipid molecules, and it appear dark brown or black color. Sudan black B. Next one is the specific esterase, chloroacetate esterase stain. And here there is a substrate in dye which is a naphthol AST chloroacetate. This is specific esterase enzyme is present. If there is a specific esterase enzyme present, like in granulocyte and mast cell, it cleaves the substrate, freeing a naphthol compound and which immediately couple with the diazonium salt, which is a fast blue or fast red, to precipitate color dye at the site. So you will see, so red granulation you will see. So same as that non-specific esterase, there is a substrate called the alpha naphthyl acetate, and it is broken by the monocytic enzymes, and it will also release the naphthol and it coupled with the diazonium, which is a fast blue, and it produce brown to black deposit in the cytoplasm, and it is specific for the monocyte. It is specific for the monocyte or monoblast. So you can see red color. Next one is a tartrate resistant acid phosphatase TRAP stain. So acid phosphatase is present in many cells, but it will destroy by the liver form of the tartrate. In hairy cell, this acid phosphate is something different. Its isomer is completely different, so it will resist the destruction by the tartrate. So if so in bone marrow biopsy or blood smear, you can see the hairy cell which is not destroyed by this tartrate, and it will appear as these red granules. So last stain is a hematoxylin and eosin stain, and you are familiar with stain because histopathology and histology are nothing without this stain. So hematoxylin is a basic dye that bind to acidic structures such as nucleic acid, and eosin is acidic dye that bind to basic component like protein in cytoplasm, collagen, muscle fiber, and staining the pink to red color. So this is the hematoxylin stain. And last one is the Romanowsky group of stain. If somebody asks you that what stain come under the Romanowsky's group. So first one is the Leishman stain, second one is the Bright stain, third one is the Giemsa stain, fourth one is the May-Grunwald stain, fifth one is Field stain, sixth one is Diff Quick stain. So thank you so much for watching entire video, and please subscribe to my YouTube channel. Thank you so much for watching this video.